Welcome, and thank you for joining us today for our session, Keeping Pace with Women Entrepreneurs, Insights into Smarter, Faster Financial Health Measurement. My name is Danielle Hopkins, and I've been working with the Strive Women program, led by CARE and supported by the MasterCard Center for Growth over the past 2 years to help them shape their financial health agenda. I am joined today by Tanvi Jaluka, Research Lead for CARE's Women Entrepreneurship Unit, Saipriya Salla, Senior Associate of 60 Decibels. As we only have 30 minutes for this session, we will try and take a few questions at the end, but feel free to drop your questions in the chat and we will monitor them. We'd like to thank CFI for hosting another annual Financial Inclusion Week. It's really exciting to see financial health and resilience as a key focus of this year's conference. In her keynote address on Monday, Queen Maxima mentioned that one of the three top priorities for financial health should be designing customer-centric tools that make financial health choices easy, using data and behavioral insights. In this session, we'll focus on financial health, what it is, why it matters for women entrepreneurs, and how we can measure it in a faster, smarter way. But first, let's watch a video that shows a bit more about Strive Women's journey to do this.
Strive Women is a multi-country program led by CARE and supported by the MasterCard Center for Inclusive Growth. We support women entrepreneurs in Pakistan, Peru, and Vietnam with the products and services they need to grow their businesses, improving their financial health along the way. Across the industry, a major shift is happening. We are moving beyond financial inclusion to place greater focus on financial health. As the latest Findex and other studies show, more adults are formally included in the financial system than ever before, with account ownership in low and middle-income countries nearly double in the last decade. Yet access has not translated to resilience. Many women entrepreneurs remain economically vulnerable, showing that financial inclusion is a powerful tool, but not the outcome. This is why Strive Women measures growth and financial health more holistically. But how do we do this? When we asked women entrepreneurs what success means to them, their answers went beyond traditional metrics like financial inclusion and income. From these insights, we developed a framework built around 4 pillars of financial health, financial resilience, business management and growth, confidence and control, and quality of life. This model recognizes that women's ability to thrive depends on both financial and non-financial dimensions. We also know that realities shift as women face new challenges and successes. Yet many existing approaches to measuring financial health are too slow, costly, or complex to capture these shifts at scale. In response, Strive Women co-created a financial health scorecard designed to measure pathways to financial health more frequently and identify where entrepreneurs need the most support along their journey. It's also AI-enabled, so the questionnaire can reach more people while retaining the personal back and forth between an entrepreneur and an enumerator.
¿Se siente segura al hacer preguntas y negociar condiciones con diferentes fuentes de financiación para su negocio?
No entiendo la pregunta.
Claro, Mariana. Le pregunto si se siente cómoda y segura al hablar y negociar con bancos u otras entidades que ofrecen dinero para su negocio. Diría que está totalmente de acuerdo, no, algo en desacuerdo o totalmente en desacuerdo.
Our financial health research helps capture the nuances of women's outcomes, measuring them more often, more accurately, and at greater scale, so programs and policymakers can act on real needs.
Over the past 10 years, there has been an increasing number of organizations that have placed a priority on defining and measuring financial health. This includes the Consumer Financial Protection Bureau, the Financial Health Network, formerly CFSI, CFI, UNCDF, OECD, and most recently, the UNSGA Financial Health Working Group, which was convened by Queen Maxima in 2020. These organizations vary in their approaches to measure financial health. Some focus on individuals, while others focus at the enterprise or MSME level. Some use subjective measures, such as self-perceptions, while others use more objective measures, such as outcomes. Tanvi, can you tell us a little bit more about what sets Strive Women's financial health framework and scorecard apart from the others?
Yeah, absolutely. Thanks, Danielle, for your question. And hi, everyone. I'm so excited to be here and join so many amazing speakers for Financial Inclusion Week. So to answer your question, first, we definitely took inspiration from a number of existing financial health frameworks and questionnaires, including the ones that you mentioned. We looked closely at the topics they covered, the structure of those surveys, the types of questions they asked, and the length of those questionnaires. But ultimately, our goal was to create a definition and framework for financial health that really worked for women entrepreneurs who lead micro and small businesses in emerging markets. And this was a gap we hadn't. This was a gap we identified and something we hadn't seen in existing frameworks. So as was shown in the video, we had really rich conversations with entrepreneurs and found that success is something that they define holistically and includes ideas related to certainly business and financial outcomes, but also includes improvements in things like stress, confidence, and quality of life. So we wanted to build these ideas into our financial health framework. The other key piece that our framework recognizes is that financial health is really a journey, and the steps of which we broadly define as improvements in knowledge, attitudes and confidence, and skills and behaviors. So we know that human behavior doesn't suddenly change overnight. So we can't expect someone to take a business management class and suddenly have 3 months of capital set aside for emergencies. We know that people first build knowledge, then attitudes start to shift. And over time, those shifts translate to behaviors and outcomes. And just to give everyone a concrete example, so one set of questions we ask in the framework around digital payments goes through this journey flow. So we start first with a knowledge-based questions. So how much do you agree with the following statement? I know how to use digital payments when doing business with customers and suppliers. Then it's an attitudes-based question. So how much does the respondent feel that digital payments are important to manage their business? And then finally, it's a skills and behavior type question. So I use digital payments actually for my business, and then here are all the activities and use cases I use it for. So this approach helps us capture and measure these really key intermediate outcomes, which indicates important progress, but practically from a programmatic perspective can help us figure out where to focus programming next. So whether it's a behavior change campaign or like a one-on-one skills building program.
Great. It's great to hear about creating a pathway to financial health as an outcome and not thinking about financial health just as an outcome, but actually as a journey to get there. As Queen Maxima pointed out in her keynote address, customer-centric tools are important for financial health. So can you tell us a little bit more about how Strive Women's Financial Health Scorecard integrates that important design consideration?
Yeah, it's a really important point, and I'm glad she brought it up in her keynote. And from the beginning, Strive Women wanted to integrate women-centered design principles in designing both the framework and the scorecard. So as I mentioned earlier, we anchored the process in conversations with the entrepreneurs we work with. But even from a usage perspective, we always wanted this to be more than just a plain research instrument. And we wanted this to be something useful for entrepreneurs. So we designed it almost like a personal health tracker. So after completing the scorecard, each entrepreneur gets a simple, easy to understand score and tailored recommendations and tips. We'll eventually pair it with tools such as trackers for managing inventory or your financial obligations, or how-tos on negotiating offers or understanding terms from financial service providers. So based on the areas that the entrepreneur needs the most support in, based on the questions that they answer, those are the types of tools that we'll end up offering. So our goal with this scorecard is really to make financial health something that entrepreneurs can take ownership over. They can track their own progress, understand their strengths, and see where they might need more support. So throughout the whole process, we wanted it to be empowering and accessible for that end user in mind.
Great. So it's great to hear about how you plan to customize the tool for each women's financial health journey and to empower them as well along this journey. As we heard in the video, some tools are too costly and too complex, and hard to scale. So Priya, could you tell us a little bit more about how you took these considerations into account when designing the Strive Women Financial Health Scorecard?
Sure. Thanks, Danielle, and hi everyone. It is great to be here in Financial Inclusion Week, and really excited to be among all of the speakers in the different sessions that we've been a part of through these days. With respect to your question, we at 60 Decibels are a tech-enabled impact measurement firm, and through our extensive work across different sectors, I think something that we've learned is that surveys really work best when they're short, when they're simple, and they're done often. Long surveys can, of course, be tiring from a respondent perspective, and also really miss that sort of quick dynamic changes that people are going through, like Tanvi was referring to, in terms of the different aspects that come into when we're looking at financial health, looking at that sort of holistic measurement piece. And keeping surveys light and frequent helps us catch these kind of real-time dynamic changes in people's lives, especially aspects like financial stress, or how much time they're spending sort of thinking about finances, sudden shocks that hit them. They tend to occur sort of hard and quick, and checking in more often gives us a much clearer picture, rather than when we do a sort of a baseline and an end line, which end up really looking like snapshots in time, and not give you that sort of journey that the entrepreneur or the respondent is going through. Speaks to the point around first building that knowledge, moving into attitudes, and really that outcome. So to be able to sort of track what that journey looks like, these kind of lean, frequent surveys help fill that gap and give you that picture, and really show you what people or entrepreneurs are going through, and help us understand, both as evaluators, as people designing these programs, how and when things are really changing on the ground. So these are really the aspects that we wanted to keep in mind when we started working with Strive Women to operationalize the scorecard that Tanvi was mentioning as well. And we're piloting that using an AI enumerator, a snapshot of which you heard in the video as well. I think just one other point that I wanted to maybe close out with here is the whole piece around why these kind of tools are important is ties into that responsiveness element, and responsiveness not only in program design. I think it's also in the way data is being collected, which is why when we're using these kind of tech tools, these AI enumerators, we're able to see what that survey journey looks like much faster. Are there questions at certain points where women are dropping off, or entrepreneurs are struggling to understand? Should we be changing articulation? Is the intent behind how we crafted a question not really landing when the survey is really being implemented? Given the speed of AI data collection, we're able to learn this faster, pivot faster, so that the data that we're really collecting is dynamic and valuable to the partners that we're working with.
Great, thank you for that. Financial health is very dynamic, so it's great to see that you're thinking of innovative ways to capture this and avoid survey fatigue. Can you tell us a little bit more? We saw it in the video, and you also touched on it briefly, but can you tell us a little bit more about how you're using AI to integrate and measure financial health with the Strive Women program?
Yes. So based on that scorecard that Tanvi also alluded to, so we basically work with the Strive Women team to boil that down to a 15-question survey that's being deployed through that AI enumerator. The idea was that how can we keep this as lean as possible so that we're getting enough data for us to understand whether, it's sort of proxy or like directional insights that, this is something that's on the right track. Are there certain tweaks or something that we need to be making in terms of the program, is really where we're coming from when we're trying to make that survey as lean as possible. And in terms of how AI is really useful in this particular approach, because they eliminate sort of human error, the fact that these kind of AI surveys can be deployed in a very uniform and consistent manner. And there is, of course, that faster turnaround of data, because you have multiple AI sort of surveys happening at the same time when you deploy that enumerator. So that turnaround time of data collection really becomes quite short. And also we are in that learning phase for a lot of these tools. But once we're able to sort of test them and we have them set up for success, we're looking at significant cost savings in the long run for partners that are implementing these, to be able to do these at those regular cadences, like we'd discussed why it's important to, especially when we're talking about aspects like financial health, I think is really where we see AI enumeration playing that sort of role.
Great. So it's really great to hear about how you're using AI to measure financial health. I know in the most recent report from the Financial Health Network, the U.S. Trends report, there was an increase in the adoption of AI tools for financial advice, more than doubling from the previous year. So AI may be an important tool to not only measure financial health, but also improve financial health. So it's something we'll want to think about as well as the trends continue to emerge in AI. Tanvi, can you tell us a little bit more about where the scorecard is today? What are we learning in some of the pilots?
Yeah, so right now we are piloting the scorecard, and we're testing it with a small group of entrepreneurs in our 3 Strive Women countries, Peru, Pakistan, and Vietnam. Pakistan and Vietnam, we're testing it traditionally through a mix of in-person enumerators and also online digital surveys. And Peru is the only context where we're testing AI enumerators right now. So we haven't shared all of the questions on the screen right now because it's quite a lot, but what our focus in right now is to understand if the questions and the design of the tool, if it's working the way we expected, and then we'll tweak it based on the feedback we receive. But the early results we see are really promising, and they're in line with kind of our thinking while we were developing this tool. So we're seeing that the average financial score amongst the pilot sample in Vietnam and Pakistan is about 70%, which we can think about as maybe financially coping or on the pathway to financial health. This means that our entrepreneurs are performing really well on several indicators, but there's still a lot of room for improvement. And as Strive Women is about 2 years into our 4-year program, this makes sense. And we're also seeing that scores often follow that pathway that I described earlier. So entrepreneurs tend to score highest on knowledge, then on attitudes, and then lowest on behaviors, which also makes sense because, as we talked about, behavior change takes a little bit of time. And by topic area, we're seeing higher scores in areas like business management and networks, and lower scores in financial resilience, which also tracks with what we know. As we talked about in the video, inclusion has increased, but resilience has kind of remained stagnant. And then on networks are often more immediately accessible for our entrepreneurs than things like capital or other formal financial services. And then we're also testing the tools and the tips that accompany the scorecard. We shared a little bit about what that could look like. We're doing a series of focus group discussions to figure out whether these tools are really what entrepreneurs are saying they need to improve their business. And that feedback is helping us tailor the content and the recommendations even more.
Great. So we're continuing along the same lines of taking this customer-centric approach of customizing and tailoring the tips and tools. And it sounds like we're kind of moving on the pathway to becoming financially healthy. It's also great to hear about the different models of testing as well. It'll be interesting to see how the models differ in terms of the results, and also to hear the feedback in Peru where the AI agent is being tested. So Tommy, can you tell us now a little bit more, what are the next steps with the scorecard?
Well, we'll continue to refine the tool based on what we're learning from the pilots. This is very much a V1 right now, and I'm really looking forward to seeing what comes out of Peru, and to see if this AI approach to enumeration is something that we're excited to scale about. And we're also really keen on testing this in other contexts outside of just care country offices. And so maybe a request to the audience here is, if this is of interest to you, please do reach out. I believe my colleagues will be dropping contact information in the chat, but it would be great to test this and pilot this tool in other programs that work with women entrepreneurs that we think might be growth oriented. We have one collaborator with Access to Finance Rwanda, so we're definitely interested in getting a wide geographic reach as well. And I think the other thing we're interested in is as Saipriya mentioned, financial health, we know, is something that fluctuates. It fluctuates in response to internal and external shocks. And so we're really excited to see if repeated use of the scorecard can help us really track those fluctuations and tie them to specific moments in time. And then, especially as we're evaluating it in the context of Strive Women, we'll be able to tie those fluctuations to the impact of different programs. But yeah, ultimately our goal is to create a tool that's really practical and scalable for a lot of different organizations, but also for entrepreneurs who want to understand their own financial journey.
Great. So we welcome your questions. As we're waiting for some questions from the audience, I'll just pose one question to Saipriya. Maybe you can tell us a little bit more about how we'll ensure that women are comfortable responding to the AI agent. What customer-centric design principles make it appropriate for women entrepreneurs?
Sure. Thanks, Danielle. That's a great question. I think we at 60 Decibels are also in that sort of learning phase when it comes to AI enumerators and really understanding what it is that can work. Replicate that experience when you're speaking to, say, a human enumerator. And with respect to this particular survey tool, I think at the bare minimum, as you heard in the video, we've used a women's voice for that AI agent to make the experience more approachable, help the women entrepreneurs sort of feel more comfortable as they begin answering these questions. And we're very explicitly seeking feedback on that entire survey experience, like Tanvi mentioned, in the pilot phase in Peru as well. And we really want to take that feedback from the pilots and look at evaluating things like improving the tone of the agent, if they're just the ability to share clear, simple instructions, articulation of the questions, or are there places where you need to be adding a pause or just explaining something more or less, just based on what that women are sharing in terms of what's working for them, or if they might want to sort of see any differences there. So really help that drive that survey tool, so that when we look to scale, then it is something that is sort of easy for a women entrepreneur to engage with and respond.
Okay, great. Thank you so much. So we have a question from Sarah Hewitt. Have you thought about gamifying the scorecard? Are there behavioral nudges that might make a difference?
Not gamifying necessarily, but I think the way we're hoping to design it is going to be that interactive element. And so we flashed it up really quickly, but you'll get a financial health score and you'll get really concrete recommendations for how you can improve that score. We'll have like a tool library that you can access, and we'll encourage someone to come back every few months or so to retake this test and see if their score will increase. And so I think those are some of the behavioral nudges we've tried to build in, but it's definitely a great recommendation.
And maybe Tanvi, just as we're waiting for more questions to come in, maybe you could talk to us a little bit more about how we chose to focus on digital payments and some of the different options for digital payments as you kind of presented in the example.
Something that we've seen in some of the qualitative work that we've done with our entrepreneurs is that digital technology is something that they're really keen on growing their skills in, but it's not something that they feel incredibly confident in right now. So there's definitely an opportunity there that we want to start to focus on. Digital payments specifically is something we wanted to focus on because we were trying to find the right level of digitization to test here. Digital payments is something that is typically very accessible for a lot of, or very available for a lot of entrepreneurs in most geographic contexts. So it's something that they might already have access to through some of their financial institutions. And it's also something that has a variety of different use cases, and the depth of those use cases can help us understand how financially healthy someone might be. So it's not just about person-to-person payments or even consumer to business owner payments. It's also about paying your suppliers. A lot of entrepreneurs use it as a way to track funds and track the flow of capital digitally. And so wanting to test something that was not so out of depth for an entrepreneur to be able to adopt for their business, but something that was very achievable.
Great. And I think as we look forward, as we heard from the keynote address from Women's World Banking today, too, that inclusive payments and digital payments are really key for women's economic empowerment, and thinking about them as different tools as well to manage and track their income and expenses. So we have a question from Rathi. How easy is it to adapt or replicate this scorecard? What potential do you see for the industry?
So it's something that we're trying to make as a tool that's very like globally centric. It's not focused on just one geographic context. And so we're super excited to test that right now in lots of geographic contexts. It's a really short questionnaire. It's meant to only be about 15 questions and take someone only about 20 minutes to answer. So the idea is that for the industry, this can be like a standardized tool that people can use to kind of get a pulse check and like regularly within their programming, or even response to certain shocks to see how that might be affecting their entrepreneurs or their target population that they're working with.
Okay, great. And then we have a question from Tyler about how often do you anticipate it makes sense for an individual entrepreneur to measure their financial health using the scorecard? Quarterly, annually? Are they able to track the evolution of their score over time?
I think we want to do it at a cadence a little bit more frequently than annually, which is typically how a lot of programs currently evaluate their programming. Whether it's going to be quarterly or every 6 months or so is something that we're still testing. Feedback we've gotten from other people who have done similar kind of like quick response surveys, or that sometimes these questions get really repetitive and then people get survey fatigue and don't want to answer them. And so that's something that we're trying to balance as well, is to figure out the cadence. I think quarterly is probably about right, quarterly to 6 months. But we also see this as a demand-driven tool. And so entrepreneurs can come to it when they feel like they want to reevaluate how they are doing. And so I think that gets to the second part of Tyler's question about their ability to track their score over time. Yes, that is the goal, that they will be able to see that progress.
Okay, great. And we have a question from Eduardo Totolo in the chat, just in terms of how we see this tool leading to policy recommendations. Sometimes financial health indices struggle to translate into policy.
Yeah, that's a great question. This is definitely very focused on the consumer side of things. We went back and forth on whether we wanted to include some like barriers into financial health into the scorecard. These barriers are definitely pieces that affect someone's financial health, and we by no means want to exclude that. But we really wanted to keep this focused on what entrepreneurs can do themselves to improve their score, and from programs, how can programs develop targeted interventions to give entrepreneurs the tools they need to improve.
Mm-hmm. Great. And as we also heard earlier today from Women's World Banking, in terms of their framework they're using to measure women's economic empowerment, we heard about cognitive change, which is knowledge, which we have in our framework, also perceptual change, increase in confidence, as well as relational change around decision making. So I wonder, Tanvi, if you could tell us a little bit more in terms of, you touched a little bit on the networks, how we kind of what networks we're talking about for the women, and what networks we're considering are important for business growth.
Mm-hmm. A lot of the networks that we've tested in the scorecard, there are lots of different dimensions. We're looking at relationships with customers and suppliers. We're also looking at relationships at a more advice level. So who do you reach out to for advice? Do you have mentors? Do you have other business owners that you talk to? So I think at long term, those are definitely the types of relationships we should be tracking. But for the scorecard, we've decided to focus on suppliers. I think the first network that business owners often develop are those networks with customers. They're often extensions of their immediate friends and families. And so suppliers, again, similar to our thinking around digital payments, we wanted to pick something that was accessible, but also something that would challenge entrepreneurs a little bit. So how can they go beyond their immediate network to find ways to expand their business? And suppliers is one of those things, is that can help them expand their inventory, expand their types of product offering, and might force them to go beyond that close network of people.
Yeah, and I think it was really interesting in the qualitative research, we saw that women would have, more than one supplier to help them manage risks, help them, in terms of costs as well, or if there was a supply chain issue. So I thought that was really interesting. Maybe Saipriya, just one question to you, as I kind of touched on that AI, just in terms of the future of AI. So, we're talking about it here to measure financial health. And as I mentioned, that report from the Financial Health Network, as people using AI for financial advice. What do you see in terms of the potential of AI for that kind of, not only to measure financial health, but to improve financial health?
I think because this is technology that's sort of changing at such a rapid pace, and really based on it ties back into what Tanvi was also saying in terms of how entrepreneurs are able to track their score, at that cadence at which we're measuring it. I think really if we can think through what the AI enumerator, of course, collecting the data, but are there ways in which that advice that's tied to what stage they are in their business, what their score is telling, really to sort of give them strategies that if they have, something that they need to be working on is marketing or business growth, or how do they build their revenue, increase suppliers. I think just to sort of think some of those use cases through and really utilize these kind of AI agents to be able to provide that kind of information, I think it becomes sort of more personalized to the entrepreneur, even in terms of the capacity building that we're doing for them beyond just sort of larger group trainings that these kind of programs tend to do. Is one use case. I'm sure there'll be multiple, as we think through how we can engage some of that.
Great. So we had another question of what was the major challenges for women financial inclusion? It's kind of a broader question.
I think something that we've seen in our baseline report for Strive Women, which I think we'll also be sharing in the chat, is that a lot of entrepreneurs do have kind of like the basic level of financial inclusion. So they may have an account at a bank. But what's less evident is how often they're using those accounts. It's not necessarily translating into mobile money account usage. We're seeing decent uptake of loan and credit products, although that differs a lot by market. Insurance is something that we found is very low, but it is something that relates highly to financial resilience. So I would definitely check out our section on that in the baseline report if that's something you're interested in. And certainly the Global Findex has a kind of like a higher level view of that in other markets.
Maybe Tanvi, just one last question before we wrap up. Maybe you could talk a little bit just in terms of the capacity building with the partners in this tool.
Could you say a little bit more?
So just in terms of building the capacity and working with the partners to build their capacity and financial health, and as they've been engaged in the field work, if you've seen any changes kind of from the partner level.
Yeah, so I think something that we want to accompany this tool at some point is going to be kind of like a user guide and recommendations for how we can help programs improve their scores. Definitely the way we've designed this tool is to focus a little bit more on the programming that Strive Women has already offered and see whether these align with actual changes in financial health. So I'm certain that a lot of these questions might not be one-to-one to some of the programming that's already out in the field, but it does seem to be a good survey of what entrepreneurs have indicated that they're interested in.
Okay, great. And so I think we have some resources in the chat as well in terms of we have our community of practice, the Women Entrepreneurship Community of Practice. There's also some resources related to some reports and baseline reports and a blog. So again, feel free if you have any other questions. I think we need to kind of wrap up in the next few minutes. I want to thank our speakers and the audience for their time today. This has been just a really insightful conversation, how to adopt more innovative, customer-centric, and systems-changing approaches to measure financial health for women entrepreneurs. I think the Strive Women Financial Health Scorecard is an excellent example of integrating some of these design principles like customer centricity, making something cost-effective, scalable into this financial health measurement tool. It's co-created, it's practical, AI-enabled, very dynamic, as we heard from Saipriya. So I think these approaches and tools can be applied in many contexts and for other target groups aside from just women entrepreneurs. So we hope you will considering using and testing this tool as we build out its use cases. We will also put our information, our contact information, how to reach us in LinkedIn if you want to reach out in terms of testing the tool. And so I just turn it over, I guess, to Tanvi and Saipriya for any last minute remarks.
Nothing huge from my end, but thank you all. And again, please do reach out. You can follow us on LinkedIn. You can add me on LinkedIn, and I'm excited to see other opportunities to test.
Okay.
Likewise, I think thank you again for the opportunity to talk about our work. And if anything that I spoke about was interesting, feel free to connect over LinkedIn, and we'd be happy to take that over.
Okay. Great. Well, thank you so much. And as I mentioned, we'll put our information in the chat. We thank you also to CFI for hosting our panel and for bringing this very important theme to the front and center of this year's conference. So thank you, everyone. Take care.
Thanks, everyone.